guys, and welcome back. Today I've selected an article from Zahidin University of Medical Sciences comparing the effects of the diode laser against acyclovir cream in the treatment of herpes labialis. Just so that we're clear, effective antiviral medications for herpes labialis, such as acyclovir, have the most influence while using them at the onset of the lesion. However, late treatment is associated with prolonged symptoms and persistent lesions. In addition, these agents should be administered several times a day, consecutive days, and sometimes have interactions with other medications. With the emergence of resistant forms of HSV and known systemic complications of long-term antiviral use, such as kidney toxicity, it's been driving research in a different direction. In general, these difficulties of controversial medications have directed investigators towards therapeutic approaches such as low-level laser therapy or diode laser technology. Low-level laser therapy has physiological effects such as anti-inflammatory, analgesic, and healing stimulatory characteristics. So in this study, it is a single-blind, randomized clinical trial which was carried out over 60 patients with herpes labialis. The patients were randomly divided into three 20-member groups. The three groups were matched and balanced by age and sex so that they could get a full spectrum and equal weighing. In the first group was treated with traditional acyclovir cream at a 5% concentration 5 times daily, administered by a professional. The second group was treated with diode lasers. The third group was treated with the laser turned off. So everyone in the room wore safety glasses. There was the sound like the laser was running, and it should be noted that none of the patients beforehand or at any point were informed about the possible benefits of the laser itself. In all three areas of focus of this study, we're measuring the size of the lesion itself and if it decreased over time. The decrease of pain intensity was evaluated based on a visual analog scale at the following day of treatment. So day 1, you get 5 treatments for whether you were doing the 1 time a day laser therapy or the 5 time acyclovir. The next morning, they would do, okay, what is your pain scale at based on that 1 to 10 that we're all familiar with. And then they were measuring the effectiveness of healing time based on crust formation. So that we know that there are going to be different people that heal at different rates, but that's why they balance these groups by age and sex. That way they had a baseline of similar things. I don't know. Based on the results of the study, they were able to conclude that using the diode laser technology showed a decrease in all three realms when compared to the controlled group where the laser was turned off and the people that were on acyclovir alone. So they healed faster, with less pain, and the size of the lesion went significantly smaller. In some of these cases, it went half the time, and there's no long-term, currently known systemic issues like the kidney toxicity that the acyclovir could be causing. I'm very much happy to find articles like this out there and that research is being done. I'll see you guys next week with the next round of what we can find and what's going on out there. See you around.